What are the types of spine surgery? Basically, spine surgeries can be divided into three types depending upon the level of spine operated. One is cervical spine surgery, second is thoracic spine surgery, and third is lumbar spine surgery. Depending upon approaches to the spine, the surgery can be divided into anterior spine surgery and posterior spine surgery. And depending upon the incision size and instrumentation used, it can be divided into endoscopic spine surgery, where a camera is used to go inside the spinal areas and excise or remove tumors or disc. The another type of spine surgery is minimally invasive spine surgery, where small cuts are taken and instrumentation and decompressions are done. And the third is open type of spine surgery. The commonest spine surgery now preferred is minimally invasive spine surgery. In minimally invasive spine surgery, because the cuts are small, the exposure is less, the recovery is very fast. So currently preferred spine surgery is minimally invasive spine surgery and endoscopic spine surgery. Thank you.